and welcome to my channel, The Medigap Show, with your host, Holly Cohen, also founder of medigapcares.org, where you can go on and book a free Medicare consultation and be a Medicare expert. So today's video, we're going to discuss prior authorizations and how they affect Medicare Advantage plans. If you're a Medicare beneficiary who's enrolled in a Medicare Advantage plan, you may have heard the term prior authorization. Simply put, prior authorization is a process used by Medicare Advantage plans to determine whether certain healthcare services and treatments are considered medically necessary. It's a way for the plan to ensure they're only paying for healthcare services that are actually needed and are within their coverage guidelines. Let's say you need to undergo a medical procedure such as an MRI or surgery. Before you can receive that treatment, your healthcare provider will need to request prior authorization from your Medicare Advantage plan. The plan will then review the request and determine whether the treatment is considered medically necessary and appropriate for your condition. If the plan approves the request, they'll provide the authorization for the treatment and you can go ahead and receive it. However, if the plan denies the request, you may need to consider other treatment options or appeal the decision. It's important to note that not all healthcare services require prior authorization on Medicare Advantage plans. Routine services such as doctor's visits and prescription coverage are usually covered without any prior authorizations. However, for more complex or expensive treatments, prior authorization is often required. So, why is prior authorization important? Well, for one, it helps ensure that patients are receiving the most appropriate and effective treatments for their health condition. But it also helps to control healthcare costs by preventing unnecessary or inappropriate treatments from being covered by the plan. So, who does it really help? It helps the insurance company, not you. Some people have criticized the prior authorization process for being too complex and time-consuming and for delaying the patient's access to necessary healthcare services. This is a valid concern, and it's important to work with your healthcare provider and your Medicare Advantage plan to navigate the prior authorization process as smoothly as possible. Unlike Medicare Advantage plans, Medigap plans are supplemental insurance plans that work alongside original Medicare, whereas the Medicare Advantage plans have taken a person off of original Medicare, and that is why they need those prior authorizations. But if a person has not gone on to Medicare Advantage and they stayed with original Medicare with a Medigap, also called a Medicare supplement plan, those plans are designed to help cover some of the out-of-pocket costs that come with original Medicare. So the 20% that's not paid for by original Medicare is paid for by a Medicare supplement or Medigap, also called Medigap plan, and also pays the co-payments and the co-insurance on most Medigap plans will pay that for original Medicare. One key difference between Medigap plans and Medicare Advantage plans is that Medigap plans typically don't require prior authorization for healthcare services or treatments. This means that if you have a Medigap plan, a Plan F, a Plan G, or a Plan N, you generally will not need to go through prior authorization process before receiving the healthcare treatment that your doctor has deemed medically necessary, because you're on original Medicare and there is a federal law in place back since 1966 for original Medicare recipients, meaning that if your doctor has ordered it medically necessary and you're on original Medicare with Medigap or Medicare supplement plan, as opposed to the Medicare Advantage program, you will receive your treatment being on original Medicare without any questions asked and without prior authorizations, because Medicare, original Medicare, when you're on a Medigap, original Medicare is driving the bus. They're your primary insurance, and that Medigap plan is simply hopping on the bus, picking up the 20% after original Medicare has paid the first 80%. So there are a few reasons why Medigap plans do not require prior authorizations. For one, Medigap plans are not managed care plans like Medicare Advantage plans are. They don't have networks or healthcare providers that they contract contract with. And they don't have specific guidelines for what healthcare services they will and will not cover, or treatments they will and will not cover, because you are on the federal original Medicare program when you're on a Medicare supplement plan, also called a Medigap plan. Instead, Medigap plans simply help to cover healthcare services that are covered by original Medicare. Another reason why Medigap plans don't require prior authorization is because they typically have more flexibility when it comes to choosing your healthcare providers. With a Medigap plan, you can generally see any healthcare provider who accepts your red, white, and blue Medicare card without worrying whether or not they're in network. So you don't have to worry if they're in or out of network when you're on a Medigap, also called a Medicare supplement plan, because it keeps you on the original Medicare program. That means you don't need to worry about getting prior authorizations for out-of-network services as you would with a Medicare Advantage plan. So if you have a Medigap plan, you generally will not need to go through a prior authorization process before receiving your healthcare services or treatments. It's because a Medigap plan, it's supplemental insurance. Medigap, the gap, it fills in the gaps of original Medicare. Medicare Advantage plans are a replacement or managed care program privatizing your Medicare, your original Medicare, it takes the responsibility and the burden off of our original Medicare. If you're on Medicare Advantage, they're in control. That insurance company is in the only, not just first position, but the only position to call the shots and determine whether or not you need prior authorization. So if you are concerned about prior authorizations, then Medigap or Medicare supplement plans are a better option for you. Prior authorization is a process used by Medicare Advantage plans only to determine whether certain healthcare services and treatments are deemed medically necessary and appropriate for the patient. If your doctor says something is medically necessary treatment for you, and even if you are perfectly healthy at this time, this could always happen to someone in the future as we age. And as we know, as we get older, our bodies break down and we need more healthcare than we did as youngsters. So remember this when trying to determine whether Medicare supplement, also called Medigap, being with original Medicare, is a better option for you than the Medicare Advantage program would be because of the prior authorizations. I'm going to get into another video showing what is going on in the world of prior authorizations with Medicare Advantage. So stay tuned. Thank you. And if you like the video, subscribe to the channel. There's always more coming to give you more informative content on how to be on Medicare and make the right decisions for yourself.